The last time we spoke, you said there were 4 stages of cancer. Do you want to just briefly describe the 4 stages?
I was referring then to perhaps not, I should correct, not the 4 stages. There are 4 grades of these malignant tumours of the brain, which are called gliomas. And the gliomas are in grades rather than stages. Now we as doctors, you are absolutely right, and it's a very good question. We grade and stage tumours. So the stage is how far the tumour has gone in its natural history, and the grade is how malignant it is or how aggressive the tumour is. Now, with brain tumours, the actual staging is unimportant because you'll remember, sir, that I have said that it's infinitely rare for them to spread. So the grading, actually, the staging is not important, it's the grading. Now, grade 1 is a tumour which could arise in a patient 20 years earlier than any symptom. It's very slowly growing. It's almost nearly like normal brain. It's very subtle. It's the sort of thing that when it's later changed to a different capacity to be harmful, there'll be sort of a consultation like this. A couple will come in and you'll say, you've had this a long time. This is not new, and I hope it's not going to harm you even now. And the wife will pop up, or the girlfriend or the boyfriend, and say, oh yes, I remember the day that my husband changed. There was a slight change in him, and now I remember it. And I will say, what do you mean? What change? And they would say it was related to cooking. Obviously, I didn't ask very intimate questions of change, although I wanted to. And that's grade 1. Then we have grade 2. And grade 2 is more malignant, but still treatable, usually, still curable in many cases. Now, what I mean by cure, no tumour, and I think this will be very depressing for you all to hear this, no tumour can ever actually be totally cured. But what can happen is that the patient has the same chance of living as another person in the general population. So if a patient, a man or a woman of 82 gets a tumour and lives till 94, that would be a cure in the sense that it didn't shorten their life. But in fact, if they lived till 124, it would shorten their life. So grade 2 is not so bad, and grade 1 and 2 together, one can be reasonably optimistic. And it's very joyful when a young married man comes in their 30s, because this is usually this sort of situation in grade 1 and 2 tumours. They're usually a younger age group, and you can say, look, yes, you've got the tumour and you can live with it. Now, the interesting thing is that even after treating these tumours, and often one gives them radiotherapy, they go back to a normal life. I've had dozens of patients who've gone back to be successful lawyers, successful teachers, gone back to just a normal, happy life with their children. And this grade 1 and 2 tumours are a sort of really it's a sort of, one is very happy when one diagnoses that. Now, grade 3, we're getting into trouble, because grade 3 and 4 are somehow linked. And it's not terribly easy, even with genetic tests, even with biological tests, with immunohistochemical tests, even with the advanced diagnostic tests we have, to know if it's grade 3 or 4. And we've sort of come to realize that we can't really give a difference in outlook for these patients. There's very little difference in outlook. And I think, I don't want to be alarmist, but here we really have to fight to eradicate these tumours. Here we have to discuss every single thing that can be done. We have to say, how much of this tumour can we get rid of surgically? How are we going to do it safely? Are we going to do it with the patient awake or asleep? Because awake, we know we're not damaging normal brain. We then have to decide, look, we're really going to hit it with radiation therapy. We're going to give drug therapy. We've got to really try to go for broke. Now, if we take these tumours, this grade 3, grade 4 group, a lot of people will differentiate between grade 4 and 3. But I believe this is a mistake. They're sort of coupled together. There's no real definition that says this is going to do better as a grade 3 or this is going to be horrific as a grade 4. One has got to go for it and really try to beat the odds. Now, if somebody, and a lot of my patients will go straight to the internet and they'll see that average life expectancy, even with modern drugs and treatments, is 18 months of survival. But in actual fact, I can attest, and I don't wish to in any way build up the hopes of sufferers. I have patients who have lived 8 to 10 years. Now,
even with stage 3 and 4?
Even with stage 4 glioblastoma multiforme, it's called, when it's 3 and 4. And the other thing about these tumours, they're usually in the elderly. Now, I have to discuss this because each decade a patient gets the tumour, it's more aggressive. So the chance of survival in a 70-year-old is worse than a 60-year-old. In an 80-year-old, it's virtually, we can't do much. Now, this seems ageist. It's not my approach to medicine. I believe it's completely wrong to say an 80-year-old shouldn't be given every chance of survival, because in fact, they may have many, many years of survival, and statistically, they may have longer survival than somebody at 64 because they've got to 80. But unfortunately, in this group of tumours, the older they are, they do badly.
You mean they're more aggressive?
They're much more aggressive, and their life expectancy is shortened. And this is actually with cancer as a whole. We are not dealing with something, as I think we've discussed before, that comes through the window as a bacteria or a virus that we don't understand, such as COVID. We are dealing with a natural process of aging, and brain tumours, like all tumours, fall into this natural aging category. Because I just want to leave you with one point, and I may be too long on this explanation. If you imagine a whole lifetime, the cells are dividing milliseconds, millions, billions of cells. The chance of it going wrong will obviously be greater if you live till 80 or 90 than if you're 15 or 18. And probably there are differences in causation for the 18-year-old and I believe completely different causes for an 18-year-old to an 80-year-old. But in the 80-year-old, the brain tumour identifies with other cancers as a disease of aging. Thank you for listening. I hope you found this interesting, and if you did, please subscribe.